I'm Dr. Wooden, and this is little Mia. She's here for her second set of puppy shots today. So we're gonna look at her first and just make sure she looks healthy. So right now we're looking at her ears, make sure she doesn't have an ear infection, any signs of ear mites or anything like that. And we're gonna look at her eyes, make sure those look nice and healthy. And we're gonna check these little puppy teeth too, which are super sharp, but are looking pretty good for a little Boston. And we're gonna feel on her, make sure her lymph nodes are okay. And look at this cute little belly. That's pretty good, thankfully. You know, we always check and make sure they don't have a little hernia or anything by their belly button, because that's something that's a little common in puppies. And we're about to listen to her heart and make sure that sounds good as well. But so far, you look good, Mia. All right, little Mia, you look great. Little Mia's gonna get her second distemper parvo vaccine today, which that's gonna be a little shot she's gonna get in her shoulder. And then she's also gonna get her Bordetella vaccine, which is also known as the kennel cough vaccine. And that is actually an intranasal vaccine, so it's gonna go up her nose. It doesn't hurt them, but sometimes it does make them sneeze a little bit. And usually they do pretty well. You know, it is of course a little pinch. Sometimes they'll cry a little bit, but most of them are pretty brave. You did so good. Good job, Mia. This is the intranasal Bordetella vaccine, which is gonna go up your little nose. Some little nose drops. There you go. Make you sneeze a little bit. Well, good job. You did great. She looks great. So Mia's gonna come back in 3 weeks and get another set of puppy shots. Usually with puppies, they come in 3 or 4 times depending on their age. Usually they get a set of vaccines around 6 weeks of age, 9 weeks of age, 12 weeks, and then 15 weeks. So when she comes back in next time, she'll be about 13 weeks, and she'll get another set of vaccines then. We'll make sure she's growing and looking healthy. Look at that belly. You've been eating just fine, haven't you? This is Mia's brother. This is Ryder. I have to double check your name, bud, but we're super cute. So when puppies come in for vaccines, it's really important that they get their full set of puppy vaccines. Some people think they just need to come in one time, but it really depends on how old they are. We don't really know when maternal antibody wanes, so it's really important that they get all of their puppy shots and that we do them appropriately, so usually about 3 to 4 weeks apart. The big things that we really worry about with puppies, parvo is the big scary virus that you hear a lot about, and it's really bad around in Memphis. Distemper, unfortunately, is going around a lot too, and so that's the big vaccine that we want to make sure that they are vaccinated appropriately for. And usually that involves at least 3 to 4 sets of vaccines about 3 to 4 weeks apart. And then, of course, the other one that everybody wants to talk about is the rabies vaccine, and that usually is given about 15 or 16 weeks of age, although it can be given anytime after 12. And that's the one that, of course, the state of Tennessee really worries about. But we usually do that when they're bigger, and they also get a rabies tag and a license to show that they've had it.